Welcome to this in-depth exploration of one of humanity's greatest triumphs in the field of medicine, the development and deployment of vaccines that have nearly or completely eradicated some of the most devastating diseases known to humankind. In this comprehensive narration, we will cover the historical context, the scientific breakthroughs, the global campaigns, the challenges overcome, the current status, and the future implications, ensuring we cover every aspect mentioned in our source material without any shortening or summarization. In the annals of human history, few achievements shine as brightly as the eradication of smallpox. Imagine a disease that once killed or disfigured hundreds of millions. Gone. Completely eliminated from the face of the earth. To truly grasp the magnitude of this accomplishment, consider that smallpox epidemics have shaped human history, decimating populations, altering the course of empires, and causing immense suffering across civilizations for millennia. From ancient Egypt and China to the conquest of the Americas, where it wiped out entire indigenous communities, its impact was profound. The disease was not only deadly, but left survivors blinded or with terrible scars, affecting their lives forever. This was not an act of nature, but of human ingenuity, perseverance, and the miraculous power of vaccines. The concept of vaccination built upon earlier practices like variolation, where material from smallpox pustules was used to induce mild infection and immunity, a risky procedure practiced in Asia and Africa long before it reached Europe. But it was the safer method using cowpox that marked the beginning of the vaccine era. It all began in 1796, when Edward Jenner noticed that milkmaids who contracted cowpox seemed immune to smallpox. He took a bold step, inoculating a young boy with cowpox material. The boy developed mild symptoms, but was protected when later exposed to smallpox. The vaccine was born. This experiment with James Phipps was controversial at the time, but Jenner's publication in 1798 laid the foundation for immunology. His work was soon adopted worldwide, leading to the establishment of vaccine institutes and massive reduction in smallpox cases in many countries by the 19th and early 20th centuries. However, the disease persisted in developing nations until the coordinated global effort. Smallpox had ravaged humanity for at least 3,000 years. In the 20th century alone, it killed an estimated 300 million people. Yet, through a massive global campaign led by the World Health Organization, the last natural case was recorded in 1977 in Somalia. In 1980, the world celebrated its eradication. The WHO's intensified smallpox eradication program began in 1967, when there were still 10 to 15 million cases per year in 31 countries. With a limited budget and innovative strategies, including the use of the bifurcated needle for efficient vaccination and the focus on surveillance and containment through ring vaccination, they achieved the impossible. Teams worked in remote areas, negotiating ceasefires in war zones to vaccinate populations. The last naturally occurring case was indeed in Merka, Somalia, with Ali Mal Malin recovering in 1977. 2 years of intensive searching followed before the Global Commission recommended eradication, officially declared in 1980 at the World Health Assembly. This victory saved countless lives and freed up resources that were previously spent on quarantine and treatment. The variola virus now only exists in 2 secure laboratories. This remains the only human disease to be completely eradicated, a testament to what we can achieve when the world unites. The success inspired other programs and proved that with political will, scientific knowledge, and international collaboration, even the deadliest diseases can be conquered. It stands as humanity's greatest medical victory to date. Then there's polio, a disease that paralyzed or killed hundreds of thousands of children every year. The development of the polio vaccine by Jonas Salk in 1955, followed by Albert Sabin's oral vaccine, sparked one of the most successful public health campaigns in history. Poliomyelitis, often called infantile paralysis, terrified parents in the mid-20th century. Outbreaks would close schools and pools. The virus enters through the mouth, multiplies in the intestines, and in some cases invades the nervous system, destroying motor neurons, leading to muscle weakness and paralysis. Many survivors required iron lungs to breathe. Franklin D. Roosevelt's own battle with polio helped galvanize support. The National Foundation for Infantile Paralysis, known as the March of Dimes, funded research through celebrity drives and public donations. At its peak in the 1950s, polio paralyzed or killed over 500,000 people annually. Today, thanks to vaccines, wild poliovirus cases have been reduced by over 99.9%. Only a handful of cases remain in Afghanistan and Pakistan. We stand on the precipice of another eradication. Jonas Salk developed the inactivated polio vaccine, IPV, using killed virus. The 1954 field trial was enormous, involving 1.8 million children. Its success was announced on April 12, 1955, to worldwide acclaim. But there were setbacks, with some contaminated batches causing cases. Salk's vaccine required injections. Albert Sabin worked on a live attenuated oral polio vaccine, OPV, that could be given on a sugar cube, making it ideal for mass campaigns, especially in developing countries. It was licensed in 1961 and became the primary tool for eradication. The Global Polio Eradication Initiative, GPEI, was launched in 1988 when there were over 350,000 cases in 125 countries. Through the efforts of WHO, UNICEF, Rotary International, which has contributed over $1.5 billion and millions of volunteers, CDC, and the Bill and Melinda Gates Foundation, cases have plummeted. In 2023, there were only a dozen or so wild poliovirus cases. The challenges include reaching children in conflict zones like Afghanistan and Pakistan, where the virus still circulates, dealing with vaccine-derived poliovirus outbreaks from the oral vaccine itself in under-immunized populations, and maintaining high vaccination coverage. But the infrastructure built has also helped with other disease control and emergency responses. When polio is finally eradicated, it will be another monumental win, proving the smallpox success was not a one-off. Measles, mumps, rubella, diphtheria, tetanus, whooping cough. These once common childhood scourges have been dramatically reduced or eliminated in many parts of the world through widespread vaccination programs. Take measles. Before the vaccine in 1963, it infected nearly every child in the US, killing thousands annually. It's one of the most contagious diseases, with R0 up to 18. The MMR vaccine is highly effective, yet, due to hesitancy, we still see outbreaks. Mumps can cause deafness and sterility in some cases. Rubella, or German measles, is mild in children but devastating if contracted during pregnancy, causing congenital rubella syndrome with heart defects, blindness, deafness in babies. The combined MMR vaccine has made these rare in vaccinated populations. Diphtheria, caused by Corynebacterium diphtheriae, produces a toxin causing a thick, grey coating in the throat that can suffocate and damages heart and nerves. The vaccine is a toxoid. Tetanus, or lockjaw, from Clostridium tetani spores in soil and manure, causes painful muscle spasms. The vaccine is also a toxoid, often combined. Whooping cough, or pertussis, caused by Bordetella pertussis, leads to violent coughing that can break ribs or cause brain damage in infants. The Accelella pertussis vaccine is part of DTaP and TTaP shots. These vaccines are often given in combination to improve compliance. Their success is seen in the near elimination of these diseases in high-coverage areas, preventing millions of deaths and disabilities yearly, according to 150 Clubs of American. Each vaccine represents countless scientists, doctors, nurses, and parents working together to protect the vulnerable. Behind every vaccine is decades of research, animal testing, human trials with rigorous safety monitoring, manufacturing scale-up. While vaccines are among the safest and most effective medical interventions available, like all medicines, they can cause side effects. Most are mild and temporary: soreness at the injection site, low-grade fever, or fatigue. Serious adverse reactions are rare, but can occur. The CDC and WHO continuously monitor vaccine safety through systems like VARS and the Global Vaccine Safety Initiative. Your healthcare provider can help you weigh the benefits and risks for your specific situation. Regulatory approval, and then the heroic work of healthcare workers delivering them, often in difficult conditions, and parents who bring their children for immunization. It's a collective effort spanning generations. Yet our work is not done. Vaccine hesitancy, misinformation, and disruptions like the COVID-19 pandemic have led to resurgences. We must remain vigilant. Vaccine hesitancy has been listed by 150 Clubs of America as a top global health threat. Misinformation, amplified by social media, includes debunked claims like vaccines causing autism from a fraudulent 1998 study containing microchips or altering DNA. The COVID-19 pandemic not only led to new vaccines, but also disrupted supply chains and routine immunization, causing a backlog that led to surges in measles and other diseases in 2022-2023. Conflict, displacement, and anti-vaccine movements add to the problem. To counter this, we need better public education, community engagement, transparent communication from health authorities, and continued investment in vaccine research and equitable distribution. Programs like COVAX aimed at this but faced challenges. The story of these vaccines is ultimately a story of hope. It shows us that through science, collaboration, and determination, we can overcome even the most formidable diseases. The children who no longer need to fear smallpox or polio are the living proof of our success. And with new vaccines on the horizon, who knows what other diseases we might one day eradicate? Indeed, the future is promising. mRNA technology, proven in COVID vaccines, is being applied to many other pathogens. There are advanced candidates for tuberculosis, HIV, malaria. The RTSS and R21 vaccines are already being rolled out, and even universal coronavirus vaccines. For diseases like measles, we already have the tools for eradication if we can achieve and sustain 95% plus coverage globally. Other candidates for eradication include rubella and neonatal tetanus. Non-infectious but vaccine-preventable outcomes, like certain cancers, are also being targeted with HPV and hepatitis B vaccines. The power is in our hands. The legacy continues. Vaccines don't just save lives, they reshape our world for the better. By preventing disease, vaccines reduce healthcare costs, enable economic productivity, improve educational outcomes for children, promote equity, and contribute to global stability by reducing the destabilizing effect of epidemics. They exemplify the best of human nature, our capacity for empathy, innovation, and cooperation across borders. As we look forward, sustaining this legacy requires ongoing funding for Gavi and other initiatives, combating misinformation with facts, training the next generation of scientists, and ensuring that every child, no matter where they are born, has access to these life-saving interventions. In conclusion, the eradication of smallpox and the near eradication of polio represent peaks of human achievement. They remind us that what seems impossible can become inevitable with sustained effort. Let this history motivate us to support vaccination programs, advocate for science-based policies, and invest in the research that will protect future generations from today's and tomorrow's threats. The voice of history calls us to action. Vaccines are, and will remain, one of our most powerful tools for building a healthier, safer world.